Hello everyone, once again welcome. Today we will see another one writing task. This letter is addressed to community nurse and retirement home. This is nothing but one non-case letter, and the patient after hospitalization he is said to be discharged back into the nursing home. So let us see how to write a discharge letter, that's also a non-case letter, to a community health nurse and retirement home. Always when you will start to read the question paper, you have to read the writing task first. So for your information, just I will tell you what is the writing task. Using the information given in the case note, write a discharge letter to Miss Georgine Ponsford, resident community nurse at a community retirement home, 103 Light Street, Newtown. This letter will be accompanying Mr. Ramamurthy back to the retirement home upon his discharge tomorrow. So this is the writing task. So from here we can come to know that this is a discharge letter, and this is a non-case because it's written already that this letter will accompany Mr. Ramamurthy back to the retirement home upon his discharge tomorrow. So in this way, you have to first identify the type of letter, to whom we are writing, for what we are writing, what type of letter. Then we will start reading from the start. Mr. Lionel Ramamurthy, a 63 years old, is a patient in the medical ward of which you are charge nurse. Hospital, Newtown Public Hospital, 41 Main Street, Newtown. Patient details: name Lionel Ramamurthy, marital status widowed, spouse December 6 months. Residence Community Retirement Home, Newtown. Next of kin: Jake, engineer, and his relevant data. Cian, teacher, her relevant data. Admission date 4 February 2014, discharge date 11 February 2014, diagnosis pneumonia. So here don't forget to underline the important things. The patient name, marital status. No, marital status no need, actually this is a non case, so no need. You have to see the residence, and here the address and the address in the writing task is same. That's why we are telling this is a non-case. Admission date we need, discharge date we have to see, diagnosis also we should underline. Past medical history: osteoarthritis. Actually in this letter we don't want to see any past medical history or social background because we are not going to write the social paragraph, but we will just have a look. Eyesight is reducing due to cataract, removed 16 months ago, needed checkup. Social background: retired school teacher, financially independent, lonely since wife died, weight loss associated with a poor diet. Medical background: admitted with pneumonia. So from here we should underline admitted with pneumonia, acute shortness of breath, inspiratory and expiratory wheezing, persistent cough, and there is chest and abdominal pain because of that, fever, rigor, sleeplessness, generalized ache. On admission, mobilizing with the pickup frame assist with the daily living activities. Example: showering, dressing, etc. Very weak, ambulating only short distance with increasing shortness of breath on exertion. Next, we will see the medical progress. Febrile, inflammatory markers back to normal. That means the currently what is the condition of the patient. Slow but independent walk and shower, toileting. Dry cough, some chest and abdominal pain. Weight gain. Post reviewed by dietitian. R by V, how to read like reviewed. Nursing management, encourage oral fluids. So these all are important for your recommendation paragraph. First, just you put tick mark in the side, then you can categorize according to the priority. So first one, encourage oral fluid, proper nutrition, ambulant as per physio review. Encourage just physio deep by deep breathing and coughing exercises. Sitting preferred to lying down to ensure postal drainage. Assessment: good progress overall. Discharge: paracetamol if necessary for chest and abdominal pain. Keep warm. Good nutrition and increase fluid, as well as egg, fruit, vegetables. Now you can categorize according to the priority. So here the important thing is for medication. So you have to just write regarding the medication sentence first, that is a paracetamol in case of chest and abdominal pain. Second one, we can write about encourage the chest physio, and the next one is the postal drainage, sitting preferred to be postal drainage. And the next point, encourage for the oral fluid, proper nutrition, these everything. And along with that you can just write good nutrition to increase fluid Example, additionally, egg, fruit, vegetable, these all have to be added in the diet plan. So these everything you can write it in the last. So this much only for the recommendation paragraph. Once again, I will read you the writing task. Using the information given in the case note, write a discharge letter to Miss Georgine Ponsford, resident community nurse at a community retirement home, 103 Light Street, Newtown. This letter will be conveying Mr. Ramamurthy back to the retirement home upon his discharge tomorrow. So this same thing what I told you at the starting, the same meaning. This is a non-case because you can see the address is same and it's clearly written. He will be back to the retirement home upon his discharge tomorrow. So no need to write the social history. Introduction paragraph will be somewhat different in this case. Let us see the letter format. So this is a sample discharge non-case letter to resident community nurse and community retirement home. Date and address is 11 February 2019. Miss Georgine Ponsford, resident community nurse, community retirement home, 103 Light Street, Newtown. Salutation, dear Miss Ponsford, regarding Mr. Lion Ramamurthy, age 63. Purpose or introduction paragraph, we can state like this. I am updating, this is the format, please note that this is the format for non-case. I am updating you the current health status of Mr. Lionel Ramamurthy, who is recovering from pneumonia and will be discharging back into your care tomorrow. He requires follow-up care. Here, as usual, we have patient full name and the reason present medical condition, patient still recovering from pneumonia, not yet completed, still he has some discomfort. So we can write recovering from pneumonia and will be discharging back into your, that word should be there, back into your care, that is for non-case tomorrow. He requires follow-up care, that is the requirement. That's all the introduction paragraph. I will repeat you back. I am updating you the current health status of Mr. Lionel Ramamurthy, who is recovering from pneumonia and will be discharging back into your care tomorrow. He requires follow-up care. The next, we will see the present medical history. This is simple conclusion what patient has undergone during hospitalization. Actually, in the writing task, they didn't mention anything regarding the medication or like nursing management. Just they have written like a common general care what they have given, and at the presently or currently, what is the condition of the patient, how much he has improved from the pneumonia. So we will see what is the thing we have to write it in the present medical history paragraph. Mr. Ramamurthy was admitted on 4 February 2019 with the complaints of shortness of breath and associated symptoms of his diagnosis. Here, actually, most of you will think that why we didn't write all signs and symptoms, because this is a non-case and the resident nurse to whom we are writing the letter, she or he is the one referred along with referred this patient to our hospital along with the advice from general practitioner. So these all signs and symptoms are known for, this is known for the reader, because these patients belong to them, so they knows what was the condition at the time of referral of this patient from the nursing home to the hospital. So no need to mention irrelevantly all signs and symptoms in this paragraph. This is only for non-case, not for all the cases. So here's just simply we can write Mr. Ramamurthy was admitted on 4 February 2019. We can just mention with the complaint of complaints of shortness of breath and associated symptoms of his diagnosis. Then we can write his hospitalization was uneventful except increased shortness of breath during exertion. During hospitalization, there was nothing complicated, but there was increased shortness of breath during exertion. However, after all management, what is the condition of his, the progress of the patient? We can write like this, however, comma, he can ambulate slowly and can perform daily living activities independently. In addition, he gained 1.5 kilogram weight as per his dietitian. Currently, he made good progress even though he has dry cough as well as mild chest and abdominal pain. So here you have to think about two connectives, however and even though. So if you are confused to use these two, please don't try to keep irrelevantly. So if you are confident to keep to use these two connectives, it's okay, fine. I will just give you an explanation for these two connectives. Here you can see that we wrote his hospitalization was uneventful except increased shortness of breath during exertion. So that is a negative thing. That means the patient had some problem. Then we are going to write something positively. That means he can ambulate slowly and can perform daily living activities independently. So that means even the patient have such increased shortness of breath during exertion. Currently, he can ambulate and can do the daily living activities. That means after one negative, if you want to tell one positive, you can use the however, and just opposite. You can say even though. Here we are we wrote already some positive. That means he can walk, he can do some activities selfly, and he gained 1.5 kg weight during hospitalization. Then we are going to write that currently he made a good progress. That means these all are positive. Again, we want to write that still he has dry cough as well as mild chest and abdomen. This is like a negative. So after one positive, if you want to write one negative, you can use this even though. If it is there is a, if there is good progress even though there is some problem, like that. So even though he has dry cough as well as mild chest and abdominal pain, so because of this reason we could not write he has recovered from pneumonia. We can write he is recovering from pneumonia because still he has some discomfort and signs, some signs and symptoms. So this is the reason why we have written the reason present medical condition in such way. The last paragraph is a recommendation paragraph. Here we will, before I told you how to segregate or categorize the recommendations, so we just put the numbers there. Here we are going to write like a sentence. Kindly administer paracetamol. So the first priority is for medication. Kindly administer paracetamol tablet to Mr. Ramamurthy in case of chest or abdominal pain. Then please make sure that he is performing chest physiotherapy by deep breathing and coughing exercise. So this is the second one. Third priority, it is for postural drainage. It is essential for him to ensure postural drainage while sitting rather than lying down position. Kindly note his diet plan needs to be monitored for increased fluid intake as well as nutritious foods like egg, fruits and vegetables. In addition, please note to keep him in warm environment. So these are all the recommendation paragraphs. So according to the priority, we have to write down here. Please don't write like simply like a scattered manner. Just organize and just write it down as a complete sentences. So here we can use it would be appreciated if you could, kindly, please, kindly note, please note, and it is essential for him, and it is vital for him to, it is important for him to. Everything we can use, but use it properly, and in one sentence itself you can make 3 or 4 important things, like 11 things. You can make it like as well as, with the use of as well as, or with the and, in addition. So these all will help you to improve your writing skills. So once again, I will tell you the recommendation paragraph. Kindly administer paracetamol tablet to Mr. Amamodi in case of chest or abdominal pain. Please make sure that, comma, he is performing chest physiotherapy by deep breathing and coughing exercise. It is essential for him to ensure postural drainage while sitting rather than lying down position. Kindly note, comma, his diet plan needs to be monitored for increased fluid intake as well as nutritious foods like egg, fruits and vegetables. So in addition, please note to keep him in a warm environment. The last one is a conclusion paragraph. It is common for all letters. Please don't hesitate to contact me if you have any queries. Here we have reader name, so you can write yours sincerely, registered nurse or charge nurse. That's all our letter to the community health nurse in the retirement village. I hope which is clear for you. Thanks for watching, and we will see in the next video. Bye then. Hello everyone, once again welcome.